Diabetes is a growing epidemic in Canada and one of the biggest drivers of our healthcare costs. So timely access to diabetes education for people with diabetes and managing the illness truly helps to prevent the complications and reduce the economic burden of the disease. In our region, what we found is that only about 20 to 30% of people with diabetes truly access the diabetes education programs. And when we asked around healthcare providers, what we found is their complex referral systems, such as having multiple referral forms and multiple services and pathways, really prevented them from making the referral to the right program. In 2013, Halton Healthcare received funding to develop and implement the Central Intake Program to create a single access point for all diabetes education referrals in this region. The vision of the Central Intake Program is to act as a single door for patients, for caregivers and healthcare providers to access services fast and timely so that they can take care of their condition.
Central Intake has really enabled the diabetes services across the region to perform at a very high level. It provides the right care at the right time in the right place. So patients can be seen where they need to be seen, when they need to be seen, in a timely fashion. What this really means is when you're out in the community and you have a new diagnosis of type 1 diabetes or type 2 diabetes, you're not left to your own devices. There is somewhere for you to get quick and timely access.
We were very excited to submit for this award because we truly wanted to showcase the partnership and the collaboration that exists between Central Intake and the 6 diabetes education programs in this region. We wanted other programs to use this as an example how working together you can make things easier for the patient and to get them the help that they need faster.
There were a couple of things that the evaluators felt the diabetes submission articulated very well. They were able to standardize 3 really important parts in diabetes care, being the referral form, being the insulin ordering, and establishing regional referral criteria to the programs. That's a huge accomplishment. As a result of that, they were then secondly able to demonstrate a really good outcome at the systems level. The programs collectively have been able to achieve a 28% reduction in ED visits for this patient population, acknowledging what a scarce and constrained resource our acute care facilities are in this region. That is a huge accomplishment.
Central Intake is a single entry point for all patients that need a referral for their diabetes. Healthcare providers like it because patients are seen at the right diabetes center within a reasonable amount of time.
I think that for patients, having our team is really comforting because they get to sort of be aware of the process of their referral, where their referral's going, and sort of why it's being directed to a specific program.
I had called this patient, his name is Joe, and he was a little bit scared because he was very, very surprised that I was calling him and trying to book him an appointment that quickly. He was thinking that it's going to be 3 to 4 months for him to get into programs, but he was very pleased that we could get him in and see him that quickly because Central Intake triaged the referral and they realized that he needed to be seen soon. So Joe was seen within 3 days instead of 2 to 3 months.
When urgent cases come in, the clinician at Central Intake is on the phone to me before we've even received the referral here at the Diabetes Management Center, and we're having a discussion about clinical next steps, about the urgency of those next steps. And because we are such a large program here, I'm actually able to keep urgent triage spots open, and we will have those people in same day, next day.
It's so rewarding to hear patients say, "Thank you so much for helping us so quickly."